In this video, I'm going to talk about cystic fibrosis, one of the famous Nclex topic that you must know before you take your Nclex exam, because on your exam they're gonna ask you a lot of question about cystic fibrosis. So one of the famous Nclex topic that you must not skip it, right? And I will try to explain you in simple words, and I will only discuss about the bullets points that you need to know for your cystic fibrosis, right? So let's start. So in a normal person, what happens in a normal person, right? I'm talking about normal person. What happen? Our mucus is very thin and slippery, right? Our mucus is very thin and slippery, right? But as we inhale lot of bacteria in. So what happen? Our secretion trap all the bacteria, right? Our secretion trap all the bacteria that we inhale. So what happened next? Because our secretion is very slippery, right? Thin and slippery, and the job of willy, like finger like project, like you heard seen like willy, right? So willy what does? It's move the secretion, keep moving from the organs, so it will not let the your mucus stick on the organs, so it will keep pushing like this, finger like projection, it will keep moving secretion like this, correct? So that is happening in the normal person. But what happen in cystic fibrosis? So in cystic fibrosis, when your mucus become very thick and sticky, once your mucus become very thick and sticky, what gonna happen next? So as the mucus will build up, it will cause damage, infection, and it will stick it to your important organs, right? Now let's say as we inhale all the bacteria, right? As we inhale the oxygen, all the bacteria is going in your body, right? So what happens? These bacteria will stick with your thick mucus, and willy is trying to push this mucus out of the main organs, but because of very thick, the willy is not able to push it out, right? It's not able to push it all your mucus out of the organ. So that's why that is happening in the cystic fibrosis, when sticky mucus, thick mucus stick with your organs, like it's gonna stick in the airway area, it's gonna stick with on your pancreas, glands, lungs, all the digestive, reproductive system, main organs, it's gonna stick it there, and it will cause problem, right? So what organs are affected by the cystic fibrosis? As I mentioned, the pancreas, lung, digestive, sweat glands, reproductive system, all main organs are affected by the cystic fibrosis. And I'm gonna discuss about what happened to the digestive system. So let's talk about it first. So cystic fibrosis is typically diagnosed in early years, in between 0 to 5 years of age. So I'm going to discuss about what happened in the digestive system first. So when the child eats their meal, right? When the child eats their meal, it goes in your abdomen, right? So the pancreas will release the enzyme, and those enzymes will help to digest all your meal, right? But in cystic fibrosis, what happens when the child eats something? All the thicky mucus that is stick with your pancreas, right? Now the pancreas ducts are blocked, and the pancreas is not able to release the enzyme to break your meal, right? So that is happening. So the child will have undigested fats, right? When the child will have undigested fat, so their stool is going to be large, oily, foul smelling, and fruity nature of the stool. That's a characteristic of cystic fibrosis, right? So when this happens, their meal is not digesting well, so that means they're gonna be lack of energy, right? So what they need now? They need high protein, high calorie, high fat diet. These three things are very important for the Nclex. They need high calorie, high protein, and high fat diet, right? So as I mentioned, the pancreas is not releasing the enzyme to break down this meal, right? So what gonna happen when child eat any meal? With meals and snacks, you have to give pancreolipase capsule. You have to give pancreolipase capsule, which is known as creon capsule. These are the enzyme capsule, and you have to give with each meal and snacks whenever the child eat. This is very important thing for your Nclex. So pancreolipase, known as creon capsule, is an enzyme capsule that you have to give with each meal and snacks, right? So just imagine I have a ketchup bottle. If I turn that side upside down, what happened? All the ketchup is sticking all the parts, right? Now you have to tap it, right, to bring it down. So that is what happening in the cystic fibrosis children. So the thick mucus stick in their system. Now what you have to do? You have to perform the chest physiotherapy. That's the treatment that you have to perform chest physiotherapy. So in case if they ask you what is the best time to perform chest physiotherapy, you have to select the answer 30 minutes before meal or 2 hours after meal. 30 minutes before meal or 2 hours after meal to prevent vomiting, right? Which test is used to diagnose cystic fibrosis? So you must know the answer is gonna be sweat test. Sweat test. If their sweat test level is greater than 60, that means they are positive for cystic fibrosis. If their level is greater than 60, that means they are positive for cystic fibrosis. It's called sweat test, right? So another important thing, when you are performing chest physiotherapy, how you can perform it? So you have to use the cup hands during percussion. Let's say this is my back, right? So instead of tapping like this, you have to use cup hand like this angle, and then percuss during cup hand during percussion like this. This will help to loosen their mucus so it can slip down. If you tap it, it will help to loosen their mucus, right? That's the purpose of cup percussion, right? Chest physiotherapy, which is given 30 minutes before the meal or 2 hours after the meal, so the patient will not have any vomiting or nauseated, right? So if the parents ask you, will the lung transplant will help cure the cystic fibrosis? So the answer is gonna be no. The lung transplant will not cure the cystic fibrosis, but child can live longer life with that, right? So as I mentioned, the food is not digesting well, so the child will have constipation, right? So the child will be most likely to receive Miralax every single day. That will help to soften their stool, right? The child needs pancreatic enzyme to help digestive system absorb fats, carbohydrates and protein, right? So because of undigested fats, they're gonna have a lot of deficiency of vitamins. So the child need vitamin A, D, E, K. Remember that they need vitamin A, D, E, K, all those vitamins. So another word, steatoria in cystic fibrosis, best described as what? So large, oily, foul-smelling stool. That's mean fatty stool. So during your exam, they're gonna give you steatoria word in cystic fibrosis, best described as large, foul-smelling, oily stool, right? Fatty stool. So you must know about this information. So as you know, the thick mucus will stick in the lung area. All the bacteria will trap there, and it will cause recurrent lung infection. So the patient is gonna be most of the time antibiotic for that. So which bacteria is commonly cultured in cystic fibrosis? So the bacteria known as Pseudomonas aeruginosa, right? That's the thing you have to select when they're gonna give you option. Which is the most commonly bacteria in the lung? Pseudomonas aeruginosa. That's the one you have to select, right? So tobramycin is the best antibiotic to kill the Pseudomonas aeruginosa. Remember that tobramycin is the best option to select when they give you to kill Pseudomonas aeruginosa. What is the best antibiotic? Tobramycin, right? So which exercise is beneficial to clear their airway in the cystic fibrosis? So the answer you're gonna select is pursed lip breathing. Pursed lip breathing means you're gonna take a breath and open your mouth a little bit and exhale like this. Right. So in children, the swimming is going to be the best option because they can use their muscle that will help to loosen their mucus, right? So the activities that they have to avoid is outdoor activities, any sport activity, because as they inhale all the dust, that will disturb them. So that's why they have to avoid the outdoor activities, and indoor activities is preferable. Also swimming is the best option for them, right? So in cystic fibrosis, you have to connect all the dots together, right? Just imagine if the if they are having recurrent lung infection because the bacteria is trapped there and the villi is not able to move the thick mucus, so they're gonna have recurrent infection, the lung infection, right? So when they have lung infection, what's gonna happen? They're gonna have shortness of breath, they're gonna have coughing because they are trying to clear their airway, right? So you have to connect all the dots. If mucus stick on the pancreas, what's gonna happen next? It's gonna damage the pancreas, right? It's gonna stick in your abdominal wall, the food will not be digested. So you have to connect each dot together. Not only, if you just know only one word, you may not be able to crack the answer, right? So you have to connect each dot. Let's say if they are having lung infections, so what's the job of lung? What's the job of a lung, right? The lung exchange the oxygenated blood, right? So if there is a problem there, then the patient will have shortness of breath, right? The patient will have breathing issue, they're gonna have shortness of breath because the lung is not working properly. So you have to connect each dot together, right? So I hope you learn something new, and we'll continue with more great topics. So that's the wrap up of our cystic fibrosis bullets, right? So now on, whenever you see question about cystic fibrosis, try to Google any question about cystic fibrosis, and after this lecture video you will be able to crack all of your answer when they ask you about cystic fibrosis. So I wish I could do more practice question with you, and I will do in future about cystic fibrosis, but at this time that's the wrap up of our video at this time. Good luck, and I hope you will crack all of your answer when they ask you about cystic fibrosis, right?